Hello and welcome to Chapter 9. In this lecture, we will discuss characteristics of the lumbar vertebrae as well as the sacrum and coccyx. So let's get started. All right, so the largest individual vertebrae are the 5 lumbar vertebrae, which you already know. And these vertebrae are the strongest in the vertebral column because the load of the body weight increases towards the lower end of the spinal column. For this reason, the cartilaginous discs between the lower lumbar vertebrae are common sites for injury and pathology. Patients typically have 5 lumbar vertebrae, and of course they're located just inferior to the 12 thoracic vertebrae. Lumbar vertebrae are larger in comparison with the thoracic and cervical vertebral bodies, and we've seen this in lab when we've looked at the models, and we've also seen this on X-ray. The most inferior body, or L5, is the largest. The transverse processes of a lumbar vertebrae are small, whereas the spinous processes are more bulky and blunt. And the spinous processes of each lumbar vertebrae lie at the level of the intervertebral disc space below the body. So in other words, when you look at the spinous process, it slightly points inferiorly, and it lies at the intervertebral disc space. And again, you can palpate the spinous process on a lumbar vertebrae. Also notice the superior and inferior articular processes, which we know make up the Z-joints, and the superior and inferior vertebral notches, which of course make up the intervertebral foramina. So let's take a look at this lumbar vertebrae right here, and we're going to look from the top down. The intervertebral foramina, of course, are situated 90 degrees from mid-sagittal plane. And you can see that's illustrated here. And what that means for us is that if we want to see the intervertebral foramina in the lumbar spine, we need to position the patient in a 90-degree lateral. Remember, as we've talked about, the intervertebral foramina are openings between the pedicles when 2 or more vertebrae are stacked on top of each other. The upper surface of each pedicle is the superior vertebral notch, and you can see that here. And the lower surface of each pedicle is the inferior vertebral notch. And you might hear that called, the floor of the pedicle. And the superior notch is the roof of the pedicle, just so you're familiar with that. This anatomy is similar to the typical cervical and thoracic vertebrae as well. Remember, when the vertebrae are stacked, the notches line up, and those 2 half-moon, half-circle areas form a single intervertebral foramina. As a result, between every 2 vertebrae are 2 intervertebral foramina, 1 on each side, through which nerves and blood vessels pass. And you can see that relationship here. So you've got your intervertebral foramina in between the vertebrae. Similar to the cervical and thoracic vertebrae, the lumbar vertebrae also have 4 articular processes that project from an area of the junction of the pedicles and the lamina. So let's look at that here. So where the pedicle meets the lamina, you've got a superior articular process on the top and an inferior articular process on the bottom. The superior articular processes of one vertebrae meet the inferior articular processes of the vertebrae above, and remember that forms the zygapophyseal joints. The term facet, remember, which you can see here, this little purple pad is referring to the facet. That just refers to the surface of the joint that actually touches or articulates with the other process. In the lumbar vertebrae, the zygapophyseal joints form an angle from 30 to 50 degrees from mid-sagittal plane. And remember, the upper lumbar vertebrae are closer to 50 degrees from mid-sagittal plane, and the lower lumbar vertebrae are closer to 30 degrees from mid-sagittal plane. We generally position patients in a general 45-degree oblique to give us kind of a general survey of that whole lumbar region. The lamina of the lumbar vertebrae connect with the transverse processes and the spinous processes. So let's look at that. So the lamina here and here connect with the transverse process and the spinous process. The portion of each lamina between the superior and inferior articular processes of a lumbar vertebrae is called the pars interarticularis, and you can see that here. So it's part of the lamina between the processes, and it is only found in the lumbar vertebrae. You can see the pars interarticularis, remember, on an oblique L-spine image. It's the neck of the Scotty dog. So as we talked about earlier, the spinous processes of the lumbar vertebrae will superimpose the vertebral body on an AP lumbar spine radiograph. And of course, you can see the transverse processes protruding laterally behind the vertebral body. Okay, so in other words, if we were to take an X-ray of this vertebrae, you would see the spinous process superimposed with the body. And note, part of it kind of hangs down here inferiorly at the level of the intervertebral disc space. Well, good. Okay, so let's talk about the sacrum. So the sacrum, of course, lies inferior to the lumbar spine in our pelvis region, and the anterior surface of the sacrum is concave. Remember, in a child's spine, these are separate segments. Remember that? And they fuse into a single bone in the adult. The sacrum is kind of shovel-shaped with the apex pointing inferiorly, and it kind of curves anteriorly, thus kind of the shovel shape that I mentioned. The sacrum apex reminds me a lot of the patella. The apex is the pointy part pointing downward. 4 sets of pelvic sacral foramina transmit nerves and blood vessels, and you'll see that here. Again, nerves and blood vessels come through those foramina. These are similar to the intervertebral foramina that we see in the upper parts of the spine. The ala, or the wings of the sacrum, on both sides here, are large masses of bone found lateral to the first sacral segment. And the 2 superior articular processes of the sacrum form zygapophyseal joints with the inferior articular processes of the 5th lumbar vertebrae. So notice right here, the sacrum has those superior articular processes, again, that form Z-joints with L5. If we look at the lateral perspective of the sacrum, you can see that convex curvature, and notice how the coccyx projects anteriorly, right here. These curves are important for us to understand because the CR angle must be angled differently for AP projections of the sacrum and the coccyx. Remember, a sacrum gets a cephalic tube angle, the coccyx gets a caudal tube angle. Notice the anterior ridge of the body of the first sacral segment helps form the posterior wall of the inlet of the true pelvis. And we call that the promontory of the sacrum. And as you can see here, it's best visualized from the lateral perspective. So let me point that out. The sacral promontory here, again, helps form the back of the pelvic inlet in the true pelvis. Remember, we learned that in the previous unit. Posterior to the body of the first sacral segment is the opening to the sacral canal, which is a continuation of the vertebral canal, and it actually contains certain sacral nerves. So let me point that out. So behind the body, there's an opening here, which is a continuation of the vertebral column or the spinal canal. Okay, and so certain nerves pass through there. The median sacral crest is formed by fused spinous processes So look at that. You can kind of see that. You can kind of tell that these are the remnants of spinous processes. So that's the median sacral crest. And you can see how it's kind of bumpy and irregular compared to the anterior surface. It's kind of difficult to see here with this surface in the way, but think about that. The anterior surface should be smoother because that's part of the birth canal. Okay, so the sacrum articulates with the ilium of the pelvis at the auricular surface. So right here, this helps form the SI joint. The auricular surface is named such because of its resemblance in shape to the auricle of the ear. Next, look at the sacral horns right here. Those are small tubercles that represent the inferior articular processes projecting inferiorly from each side of the fifth sacral segment. And again, you only see one here because the sacrum is on its side. If you were to turn this, which we'll do in the next slide, and look from the back, you can see there's two sacral horns, which represent the two inferior articular processes of what would have been the fifth sacral segment before it fused into one bone. They, again, point inferiorly and posteriorly, and they articulate with the corresponding horns of the coccyx. So guess what? That's remnants of a superior articular process. So where those processes meet, remember, forms a zygapophyseal joint. So you can kind of see again how all of these structures share similar characteristics with our other vertebrae, but of course, because they fuse in adulthood, there are some slight differences as well. Okay, we're going to pause our lecture here. We'll begin our next and final anatomy lecture with the coccyx.